COVID-19 pandemic has also, impacted how easy or how difficult it was for mothers to be able to do this. And of course, it depends on how you look at it. We'll be talking about COVID-19 and, just how mothers, breastfeeding mothers have tried to cope during these very difficult times, especially those who tested positive for COVID and they were breastfeeding in this conversation. Do stay with us, and it begins right now. I'm having this sit down with Rose Wambu. Rose is a maternal, infant and young child nutrition manager at the Division of Nutrition and Dietetics at the Ministry of Health. Thank you so much, Rose, for creating time for us.
Thank you.
All right, so I'd like to begin from a general point. We are just marking the Breastfeeding Awareness Week. It started today, the first. It will be going all the way till the 7th of August. For many who may be asking themselves, why should we care about this week? Why is it important? What inspired it?
Okay, this is a global event, and by the realization by the World Health Organization and UNICEF, that breastfeeding needed to be advocated for. Therefore, in 1990, there was a declaration which was made in a town in Italy, the Innocenti town, and it was agreed that at least on a yearly basis, breastfeeding should be, awareness should be created on a yearly basis. Therefore, the first one was done in 1992. So from 1992, we've had a commemoration every year. So in Kenya, we are just like any other part of the world. We are celebrating an World Breastfeeding Week, where we want to promote breastfeeding at the highest levels. Yes.
All right. When you say we are promoting breastfeeding at the highest levels, many think breastfeeding is obvious. As soon as you give birth as a mother, naturally, you're supposed to breastfeed your child. Is it as obvious as we think, or there are issues that inform why we should be having such an awareness?
Okay, let me say, as usual, I think people assume that breastfeeding is, natural, which it should be, but it is not easy. Because it depends on how the baby is put on the breast. So if the mother is not taught properly while she's pregnant on how she will be able to attach the baby on her breast, latch, how she's going to hold the baby, then it is going to be very difficult, because the baby is the attachment will cause a lot of pain, and the mother will hate breastfeeding. However, we have breastfeeding counselors and nutrition service providers who at the facility level give this information, teach mothers and show mothers how to breastfeed their children, how to attach, how to latch. If you have twins, how to hold the twins on both sides, how to hold the baby, how to remove the air if the baby has breastfed with a lot of force, and basically that makes it interesting. But if that does not happen, it is very difficult, and especially for the young girls, they will not want to hear anything about breastfeeding.
So the challenge mostly is with first-time mothers. That's like the population that you find really lacking in this information, or it cuts across?
More so the young mothers, but it is with all mothers. Remember, every birth is an episode, so every child is different from the other. Sometimes, depending on the years, the mother may have forgotten. So she will require to be reminded. This is how you hold the baby. This is how you attach the baby on the breast. All these things. Sometimes we may assume that the mother can remember, and it's not like so.
It's not as obvious.
So this may be a that-time mother, but who is also having difficulties. And again, it depends with what kind of teaching and demonstrations were given to her during the first time. Yeah. When
should this information be passed to a mother? Is it during pregnancy, or is it after they've given birth? What's the best time for this awareness, this form of awareness, to be conducted?
This information needs to be given to girls as soon as they start puberty.
Okay.
Because you don't know when they're going to be mothers. So this information needs to be with our youth because they are the mothers of tomorrow. Therefore, all the women of reproductive age need to have this information in preparation for pregnancy. More so, we emphasize more when the mother is pregnant because that is when we have several times to meet with her. Therefore, that time we engage, we teach them, you know, we emphasize on the points that they're supposed to follow during breastfeeding so that she's prepared psychologically. Otherwise, if she's not prepared psychologically, she's not going to be able to breastfeed because the moment the baby's mouth touches her breast, she feels tickly, and that ticklish now may make her abandon. Yes.
All right. They usually say that the first few minutes after birth are very crucial in this breastfeeding journey. Probably from your perspective, you can help us understand why this is important, that as a mother, as soon as you give birth, you're supposed to begin the breastfeeding journey immediately and not wait anymore. Why is it crucial, this very first few minutes you spend with your child?
It's very crucial to attach the, first of all, to attach the infant on the mother immediately after birth. Then within the first hour of birth, the baby is put on the breast. It creates that fast attachment. You see, so it creates it makes the hormones now work faster in producing milk. There are two hormones that are involved here. One is the let down hormone, which informs there's a baby. Create milk, and the milk is let down.
So it communicates to the body that it's now time.
It is now time.
You to start,
so the moment there's that attachment, that creates now that environment.
Right.
The other one is bonding. So that bonding, you know, there's the mother's sense, the baby learns the mother sense at that stage. And finally, you know, this first milk contains anti-infective factors. So these prevent many illnesses. It is like the first vaccine for this baby. Yeah.
All right. Now that you've opened that box for me, we've just sort of gotten into the benefits of breastfeeding. As a ministry, why do you find it important to ensure that as many mothers as possible are able to breastfeed their children in the recommended way? Why is it crucial? First, for the baby, for the mother, and even for the, the family or the community at large. Why should we be focusing on this?
It's very important as a country because, as you know, I think you've seen the statistics that we lose so much as a country due to malnutrition, and we lose in billions. So one, we need to have the infants healthy. It promotes growth, optimal nutrition, because during this time that the infant gets breast milk, they get everything from that milk, all the nutrients that are required for growth. The second one is that secondly, the mother is protected against some cancers, the ovarian cancer, breast cancer, and also it helps the mother get into shape quickly, you know, and avoid getting overweight and obesity, which is one of our problems today, because 50% of the women are either overweight and obese, and that will make them
control their weight.
Yes, the breast milk will make them control their weight because of the calories they are burning.
Right.
Otherwise, breastfeed, if they with that weight, then they can easily get non-communicable diseases.
Has it been proven that it's a form of contraceptive? I've heard this a lot of times.
Yes. Thank you for pointing out that. It is scientifically proven that if a mother continuously breastfeeds, that is exclusively, without giving this child anything, breastfeeding on demand, then the amenorrhea, the return of the menses is delayed. Definitely, but that does not come if the mother gives the baby any other thing. Therefore, it is a proven way of a family planning way.
But it has to be faithfully, exclusively breastfeeding a child for the first
Exactly. Yes, it has to be the mother faithfully and adorably breastfeeding her child on demand for the first 6 weeks.
How realistic is that? Many mothers, you'd be surprised, still really struggle with that. Ensuring that your baby is not fed and is not given any other thing apart from your breast milk for the first 6 months, especially those who are working. The maternity leave is only 3 months. You're supposed to be going back to work. How do you manage to be able to do that for 6 months, leave alone even using it as a contraceptive? Just ensuring that you do what is right for your baby. What we know is that you're supposed to make sure that they are exclusively breastfed for 6 months, but it's not very easy for many women. How do you do it?
Thank you, Serfine. And I think I'll point out here, I would want all the mothers to be your height. That can't happen unless breastfeeding is done. Okay. It's because your mother breastfed you well.
Yes.
The other thing I would want to say is that we have a policy in place that we call breastfeeding workplace policy. And we have a law, that is the health law. In the workplace policy, we emphasize on provision of areas, flexi hours for the mother, you know, like discussing with the supervisor, so that this young mother or old mother, or you know, comes a little bit late and gives her all, then she gets flexi hours to be able to go and breastfeed her baby. At the same time, she is provided for with a room within the working environment to express her milk, and in this room it should be well, so that there is a fridge and there is a seat. She's comfortable. She expresses her milk, puts it in a safe container in a refrigerator, so that when she's going home in the evening, she carries her milk home. And this is the milk that will be given to the baby in the absence of the mother, so that that baby can continuously be breastfed.
How is the uptake in terms of implementation of this policy? What are employers telling you as the complexities of implementing this?
Okay, they are both public and private. Most of the employers have put up lactation spaces or rooms. One in example is Tharaka Nithi County, which has put a creche, you know, Safaricom, you know, so the mothers can come with their babies in that creche, and they are caretakers. Now, the other areas where the offices are, we still have some breastfeeding rooms. Well, I would say some in name, others are okay, and mothers can express their milk. However, the room is there, but may not be accessible to the mother when they need it. And this is where now we say employers kindly ensure this room is not converted into a store, is not converted into something else. It
should be available.
Yes, this room should be available for breastfeeding mothers whenever they need to use it.
I'm looking forward to that time, though, because it's been such a struggle to allow it to have mothers have this chance at their workplaces to be able to breastfeed their children. We've run out of time for this conversation, unfortunately. I just like you, as your final remarks, in the coming few days, what are some of the things that are lined up that we should expect that will form this Breastfeeding Awareness Week? And finally, just tell me what you feel the community should do, because you talk about supporting the breastfeeding mother. What is this support? What is it that the others can do to support this mother?
Okay, let me start by saying we have a number of activities lined for the week as a country. And one of them is sensitizing. You know, we inform everyone, and that is why I informed you earlier, and we engage everyone. We also anchor whatever breastfeeding with other existing programs, and then galvanize. And what that means is that we will engage at different levels. We are going to have counties run their edition of the World Breastfeeding Week in their own style. here there's no prescription because
how to do it.
Yes, the counties are at different levels. Some have a lot of resources, others have minimal resources on this particular area. The partners are supporting, and the partners are also supporting the counties, the national, up to the community level.
All right, in 30 seconds,
yes.
How do we support breastfeeding mothers as a community, as a society? Telling
everyone the benefits of breastfeeding. Then we also want people to support the mothers. For example, in the offices, we need those rooms and the lactation rooms to be put in place. Let the mothers breastfeed. Let our mothers not be told to go and breastfeed or remove their milk in the toilet, because nobody who is sane will have their phone in the toilets. Then the other thing is we want to engage everyone, and especially the leaders. Let them know that breastfeeding is the first feed of choice and the only sure food security that we have. Therefore, and for my young people like you, Serfine, I think let us not avoid breastfeeding. Let breastfeeding be the beauty that we are looking forward into. Like I told you, I would want all the women to be your height. You challenged me.
I see what you've done there, but it's okay. I live to fight another day. Thank you so much, Rose, for creating time and for challenging us young people to really embrace breastfeeding, because it's important to save the future generation in this country. Next week, it is the Breastfeeding Awareness Week, and we've just been talking about the importance of this particular season, but it should go beyond. It should actually go beyond just this particular week, something that we should embrace. Many think it's obvious, but it's not very obvious, if you ask me. I've been engaging Rose Wambu, maternal, infant and young child nutrition manager at the Ministry of Health. Thank you once again for your time. We're just going to be taking a very